I'm here with Graeme Jones at the Nordic Conference in Dubai. We are talking here all about hallmarks of aging, and he has been presenting amazing case studies on toxic exposure and impacting our health. So I would like to ask you, if there is one single biomarker that you think, wow, this is unmissable, we have to measure in every patient, that we should do it as practitioners. Could you expand a bit more on that?
Yeah, absolutely. I think in regards to genetics, one of the most interesting SNPs is this APOE SNP. And we have some different varieties or different tastes of that SNP. We have the E2, E3, or the one that we now know is very problematic, especially for dementia, Alzheimer's disease, the APOE4 version. This APOE4, you can have one copy or you can have two copies, and especially two copies, that increases your risk of developing Alzheimer's disease quite significantly. I mean, there's some different numbers, but one that I've read recently is a 12-fold increase.
Wow.
It's a pretty significant genetic impact. So I think by knowing your APOE status, it gives you an indicator of how much do you then need to really focus on certain aspects of your environment and certain other tests related to your health. Because then we can see things like the amyloid removal from the brain is affected, tau protein, for example, and when you're then exposed to more environmental toxins and other types of infection, even the herpes simplex virus, for example, which most people have and that can get reactivated through certain environmental stresses or insults, like other infections, like for example COVID can reactivate these herpes virus infections, then it gets so important because then the advice to patients can be, look, if you want to not have a very poor quality of life for your remaining, potentially decades, you want to avoid Alzheimer's, improve your health span, then knowing your APOE4 status helps you to make better decisions then around things like toxic exposures. And of course, naturally, I'm sure most people will say, well, I want to avoid these kind of toxins, but it seems to really, it empowers you to make better choices and to know where you stand with your own personal biology to avoid that devastating condition.